Assalamu alaikum. Today I'm going to discuss a routine case of eco-emulsification. The one different thing I will do in this case will I will perform the entire case using only normal saline, and I would like the opinion, all of your opinion, that is Rexis under saline worth it? Will it cause less reaction, or does the benefits outweigh the risk of the Rexis running out? Are the modern day viscoelastic good enough that they do not cause a reaction, and there is no difference in using a good viscoelastic or doing the Rexis under irrigation? As you can see, I have started this case. It is quite difficult to maneuver this flap under irrigation. The chamber tends to collapse and I have to float in the incision to try to turn the Rexis. One of the tricks I used in one of my cases in which I did the Rexis under irrigation is I hydrated the side ports before starting the Rexis, before inserting the cystotome, which maintained a tighter chamber. As you can see, this is the last part of the Rexis, and now I'm facing considerable difficulty trying to complete it. The flap tends to flutter in the anterior chamber and it is quite difficult to control it. Now my Rexis is complete. As you can see here, I had a irrigating solution attached to my 26 gauge needle cystotome. When I do Rexis under irrigation, I normally use very little saline drop by drop so that the flap does not float too much in the anterior chamber. Now on to hydrodissection. I have to make sure that the nucleus rotates freely, and here it starts to rotate. However, the nucleus is soft in consistency and I realize that it will be difficult to chop this case. So with that in mind, I proceed on to the step of phacoemulsification. All the steps in phacoemulsification are related. If you perform one step wrong, then you will be in trouble and it will start a vicious cycle. So every step is linked to the other. Now I've decided to do a direct chop technique. In this case, I bury the tip of the phaco needle at the center of the core of the nucleus. Use a Sinskey hook to chop it, but unfortunately it does not chop. It does chop partially, but not all the way through. So now I decide to rotate the nucleus, try to hold it at a different plane, and I am able to prolapse one of the poles of the nucleus out of the capsular bag, put the chopper behind the nucleus. One of the very important points of this technique is that since the nucleus was not debulked properly, you have to be very careful trying to forcefully prolapse the pole of the nucleus out of the capsular bag when a significant chunk of nucleus remains in the center. So it is always safer to first debulk the central nucleus and then try to prolapse it. If you try to prolapse it and the patient's venules are weak, then it might cause dehiscence of the venules and of the bag. So as you saw here, The piece didn't want to come when I held it centrally, so I held it at one of the poles, and now I'm successful in try to move the bevel of the phaco needle towards the nuclear piece. It will allow easier occlusion. And here, this is probably the last piece, and the epinuclear shell comes, and here I'm done. So now I'm fast forward, I implant a single piece PMMA IOL in the capsular bag. Hope you enjoyed the video. Please give comments and suggestions, and if you have experience with this technique, please give suggestions. I have performed about 3 to 4 surgeries using this technique, so if you have more experience, please give suggestions. Jazakallah. So I hope you enjoyed the video. Please share your experiences regarding HydroRhexis and if there is any difference in the reaction. Jazakallah.